Okay guys, so in this video, I'm going to be showing you how to set up a treatment room. The first thing that you got to do is wash your hands. Your hands have to be clean, and if you don't know how to do it, go see the other video with the hand washing technique. So the first thing is you need to have your hands very clean. You're going to get a bucket and you're going to fill it with water, because the first thing that you got to do is run the lines. This is when you come in first thing in the morning. This is what you got to do. You got to run the lines for 2 minutes. So first, with the saliva ejector, you're going to put it in, and if you do this, it's going to create pressure on the lines so they can get clean. Throughout the night, the lines can get a biofilm, and that before you start the day with patients, you got to make sure that those lines are clean. So this is the way that you do it. For the video purposes, we're just going to do it really quick, but you have to run these lines for 2 minutes. Same thing with the saliva, with the air water syringe. So you're going to press the air and the water both at the same time, and you're going to be running this line as well. Again, for 2 minutes. Let's go on the other side. The same thing, you're going to run the air water syringe again. And then for the lines, this is the high speed. You're going to press both the air and the water. And you're going to press it here, and both air and water is going to come out. Again, 2 minutes each line, and this is at the start of each day that you have to do this. These two, because it's for the high speed, you press the water and the air, okay, both at the same time. You want to make sure those lines are clean. And then for the low speed hose, you're only going to press the air, because this one doesn't use water. So you're only pressing the air. Okay, that's the first thing that you do. So you run the lines. We throw this out. Okay, once you're done with that, then you're going to go ahead and prepare the tray and put all the barriers on the chair. So you're going to get the tray, you're going to get the tray cover. For the classroom, you're not going to use any of what we have up here. You're going to come over here, and you're going to get a saliva ejector and HVE. You're going to take out 2 air water syringe tips, the bib, and the bib holder is here. You're going to get 2 cotton rolls, 2 2x2s, a headrest cover, and 4 sleeves. 2, 3, and 4. So 4 sleeves. And in every chair at the office that you're working at, make sure that you know all of the barriers that you need, so you're not back and forth. So this is just for a basic setup. So you're just going to take all of these out. You're going to need 4 barriers for this chair, 1 headrest cover, a bib with the bib holder, the suctions, that is the saliva ejector, the HVE, and 2 air water syringe tips. The disposables, 2 gauze, 2x2s, and 2 cotton rolls. Then you're going to get a basic. And now we're going to start setting these up. So you're going to place the saliva ejector. You're going to be placing the HVE. Make sure that it's with the hole facing up. If you by accident place it this way, you got to throw it out, because all of this is it's contaminated. So make sure that you place it with the hole facing up, and you press it in. Then you're going to get the air water syringe tip. Make sure that the outer ring, you're pressing it in, And this part over here, I don't know if you can see that little hole on the inside of the air water syringe. So this is the part that goes in, not this big one. So it's this little part there, and you pull it and tug it just to make sure that it's in there. And right over there, you're going to place, so you're not moving back and forth and you are efficient with your time. You're going to place the covers right away. So 3 goes here. Now we're going to go on the other side, and everything, if you do it in a loop, you're going to see that your time is going to be more efficient. You're not going to be losing time. You're going to put the air water syringe tip here. Again, pull to see, and then over here, the sleeve. If you have sleeves for the light handle, you could also have one. Like I said at the beginning, you have to make sure that you know the chair that you're working at and how the office that you're working at places barriers. So this is how we do it here. It's 4 of the sleeves, 1 headrest, and now we're going to put the tape. So then you go and get the tape. For this over here, you're going to use 9 tape. Okay, so we're going to place it in all of the areas that you're going to be contacting when you're working. So over here, these buttons, make sure that you're not pressing and touching. You're just going to place it in there, so when the patient comes in, is going to feel comfortable that this was not manipulated, that he's going to be the one being treated in that chair. So this area, because we're going to be using the buttons, moving the patient up and down, that needs a cover. Over here, this needs a cover. Again, don't worry, keep it like that. Don't be pressing it on it, because then the patient is not going to feel comfortable. They're going to see that that chair was used. Over here, we put another one here, just because sometimes this moves, so we can have access to the hand pieces. So we're going to put one here so we can touch it here when we're working. Again, like I said, everything in a loop. So we did this first. Now we're going to go to the headlight. So again, you put it down, and here we're going to do it vertically. Don't do it like this, because when you touch it, you might be touching these areas. Always, use your common sense and make sure that you are covering those surfaces in the best that you can. Again, these have also sleeves that they cover the whole thing. So okay, so we got 1, 2, 3, 4, 5. Then we're going to go over and 6. 1, 2, 3, 4, 5. Then we're going to go here. We're going to fold it, and we're going to do it this here. 6. Over here, we can touch this. So we're going to do 1 over here. 7 here is 8. And then with the assistant chair, we have 9. Again, the handle, we're gonna fold it, and we're gonna place one over here. So 9 of the tapes. So okay, very important that you know the chair that you're working at. Here at the school, you are going to be doing it this way, but when you go to another office, you might be doing it differently, and that is okay, but you have to know your chair and the barriers that you use. The more you know, you're gonna know what to take out, and you're not gonna be walking back and forth to get it. You have to use your time efficiently, because patients are waiting outside, the doctor is waiting for you. So the more you know, so if you know, okay, I'm going to use 9 tapes, I'm going to use 4 of the sleeves, you take all of them at the same time, and it's going to be a lot better. So that's the way that you guys are going to be setting up the room in class.